Cardiac tamponade is a critical medical condition characterized by the accumulation of fluid within the pericardial sac surrounding the heart. This abnormal accumulation of fluid exerts pressure on the heart, compromising its ability to pump blood effectively. Left untreated, cardiac tamponade can quickly become a life-threatening condition, necessitating prompt recognition and intervention. In this comprehensive script, we will delve into the various aspects of cardiac tamponade, ranging from its etiology and pathophysiology to its clinical presentation, diagnosis, management, and long-term prognosis. We will also explore the latest advances in treatment and discuss the unique considerations in diagnosing and treating cardiac tamponade in specific patient populations. Cardiac tamponade is caused by trauma, infection, malignancy, or certain medical procedures. Fluid accumulation within the pericardial sac increases intrapericardial pressure, impairing ventricular filling and reducing cardiac output. This results in decreased blood pressure and potential organ hypoperfusion. The clinical presentation of cardiac tamponade varies based on fluid accumulation rate. Key signs include Beck's triad, hypotension, distant heart sounds, jugular venous distension, and pulsus paradoxus, exaggerated BP drop during inspiration. Other symptoms include dyspnea, tachypnea, chest discomfort, and lightheadedness. The diagnosis of cardiac tamponade requires a combination of diagnostic tests. Echocardiography is the primary tool, allowing visualization of the pericardial effusion and assessment of the heart's function. Electrocardiography provides supporting evidence, while imaging techniques like chest X-ray and CT scans offer additional information. These hemodynamic changes ultimately result in compromised tissue perfusion. Without adequate cardiac output and systemic blood pressure, organs and tissues receive insufficient oxygen and nutrients, leading to impaired function and potential organ damage. Differentiating cardiac tamponade from other conditions presenting with similar clinical features is crucial. Several conditions share common symptoms, and a comprehensive evaluation is essential. Tension pneumothorax, for example, may present with profound hypotension, diminished heart sounds, and jugular venous distension. Similarly, acute myocardial infarction can cause hemodynamic compromise and may initially mimic cardiac tamponade. Pulmonary embolism may lead to right ventricular strain, resulting in clinical findings similar to those seen in cardiac tamponade. Close attention to history, physical examination findings, and diagnostic studies can help distinguish between these conditions. When suspecting cardiac tamponade, immediate steps are vital. Fluid resuscitation helps optimize preload but should be controlled to avoid worsening tamponade. Pericardiocentesis, guided by imaging, relieves intrapericardial pressure. Surgical intervention may be needed for recurrent or unstable cases. In the video on pericardiocentesis technique, we will cover patient positioning, site selection, and potential complications. It is crucial to understand these details to ensure a successful procedure and minimize risks. Overall, these imaging techniques offer valuable information about the extent and underlying causes of cardiac tamponade. They aid in clinical decision-making and surgical planning, providing a comprehensive evaluation of the condition. Once the acute phase of cardiac tamponade is managed, the long-term management of pericardial effusion comes into focus. Regular monitoring, medical therapy, and potential surgical interventions are vital strategies. Serial echocardiography is essential to assess the degree of effusion and evaluate the patient's clinical response. If the effusion persists or recurs, additional interventions may be necessary. Non-surgical options, such as anti-inflammatory medications or corticosteroids, can be considered in specific cases. However, if chronic effusions persist or cause significant symptoms, surgical interventions, such as pericardiectomy, pericardial window creation, or pericardial drainage catheters, may be required. Cardiac tamponade presents unique challenges in certain patient populations. These considerations are crucial when diagnosing and managing cardiac tamponade in special situations, including pregnant women. Pregnancy-related changes in cardiovascular physiology can complicate the clinical presentation and management of cardiac tamponade. Close monitoring of both the mother and the fetus is essential. Patients with renal failure. Renal failure can contribute to pericardial effusion development, and its management requires consideration of the patient's underlying renal function and dialysis needs. Patients on anticoagulant therapy. Patients receiving anticoagulant medications have an increased risk of bleeding complications with pericardiocentesis. Close collaboration with a multidisciplinary team, including hematology specialists, is necessary to mitigate risks. Cardiac tamponade can lead to severe complications if left untreated or inadequately managed. These complications may include cardiac arrest, cardiogenic shock, organ failure, or the development of constrictive pericarditis. Early recognition and intervention significantly improve patient outcomes. However, the overall prognosis depends on various factors, including the underlying etiology, promptness of treatment, and the presence of coexisting comorbidities. Advances in the management of cardiac tamponade continue to evolve. Percutaneous balloon pericardiotomy, also known as percutaneous balloon pericardial tamponade drainage, has emerged as a minimally invasive alternative to surgical intervention. This procedure involves the use of a balloon catheter to create a controlled communication between the pericardial sac and a drainage system, facilitating effective fluid removal. Similarly, pericardial drainage catheters can serve as a less invasive option, providing continuous drainage and monitoring of pericardial effusions. These emerging therapeutic approaches offer potential alternatives to surgical interventions and may be suitable for selected patient populations. Cardiac tamponade is a serious medical emergency that requires quick recognition, accurate diagnosis, and prompt intervention. Knowledge about the causes, mechanisms, clinical signs, and diagnostic techniques is crucial for medical professionals involved in the care of these patients. Effective emergency management, appropriate pericardiocentesis procedures, utilization of imaging technologies, and long-term follow-up strategies are important for improving patient outcomes. Ongoing research and treatment advancements have enhanced the prognosis for patients with cardiac tamponade. Therefore, healthcare providers must stay updated and adapt their practice to provide optimal care for these patients.